Hello everyone. My today's topic is cardiac output and the autonomic nervous system influences on that cardiac output. Okay. So objective of this video or this lecture is how the sympathetic nervous system control the cardiac output, how the parasympathetic nervous system control the output, and how the carotid sinus massage control the heart rate. Okay. So first of all, we're going to talk about the innervation. Okay. So there's a sensory information that senses goes like through certain nerves. Okay. So first it is going to be the glossopharyngeal nerve. Okay. The next is going to be the vagus nerve. Okay. So glossopharyngeal nerve is going to be um, they're supplied by the carotid sinus baroreceptors and carotid body chemoreceptors. Okay, so the baroreceptors is the one that is going to be sending the signal of the pressure from the carotid artery going towards the midbrain. Okay, and the vagus nerve is going to be coming out from the aortic sinus, from the arch of the aorta, the baroreceptors, which is the pressure receptors within the aortic sinus, okay, arch of the aorta, the pressure sending towards the midbrain as well via the vagus nerve. The aortic body, okay, that is sending the chemoreceptors. The chemoreceptors for both, okay, for the chemicals, which means the carbon dioxide and oxygen, and the acidic, if there is more carbon dioxide, there will be more acid. Okay, so that is going to be send the signal towards the midbrain as well. Okay, so the motor innervation, okay, we're sending the signal down. Okay, it is the dual innervation. Okay, the heart is dual innervated, the heart, which is the sympathetic nervous system, and then the cardiac innervation. Okay, sympathetic is simply like those cardiac innervation, sending the what is it called? Sending the hormone called norepinephrine, which is increasing of the heart rate, and but the parasympathetic nervous system, which is what is it called, supplied by the vagus nerve, is releasing the acetylcholine. The acetylcholine is going to decrease the heart rate, okay, because it is the parasympathetic nervous system. Adrenal medulla, on the other hand, it is going to secrete the epinephrine and norepinephrine. Okay, that is also the affecting the heart rate and also the blood pressure. It affects both. Okay, so how does it happen? As you can see that the factors affecting the heart rate was autonomic nervous system and hormones. Okay, the autonomic nervous system, which is the what is it called? So autonomic nervous system like parasympathetic and sympathetic. Sympathetic nervous system increase the heart rate and parasympathetic is going to be decreasing the heart rate. Same way certain hormones is going to be what we call increasing the heart rate. For example, the beta agonist, okay, which is the affecting the or stimulating the beta receptors on the heart and causing the increasing the heart rate. Okay, so factors affecting the end systolic volume, okay, which is not going to be going to be the topic, but can explain it briefly. That end diastolic volume, okay, and then what does it do? That whenever it is going to be increasing, okay, the increase. So that is going to be causing the increasing of the cardiac output. When the end systolic volume is going to be increased, it is going to be cause the decrease of the cardiac output. So which is as you can see right here, the the stroke volume, if it is end diastolic volume is increased, is going to be increasing the cardiac output. If it is end systolic volume is increased, it is going to be decreasing the cardiac output. Okay. So right here, as you can see that I was talking about earlier, that how the sympathetic and parasympathetic nervous system is supplying the heart. Okay, all right. And in this one, it say it is showing that how the in the carotid sinus. Okay, this is supplied by what is it called, the glossopharyngeal nerve. Okay, And right here we have the arch of aorta is supplying by the vagus nerve. Okay. The parasympathetic tone at rest, okay, the person is not, okay, is working out or anything like this, or anxious, okay. So parasympathetic tone is going to be greater as compared to the sympathetic tone. A sympathetic tone is going to be greater whenever a person is exercising or anxious, okay. So SA node, okay, is sending the what do they call signal like 60 to 100 beats per minute, but the resting heart rate is 70 to 80, which means that not all the signals can cross the AV node within the cardiovascular system within the heart. Okay. So, cardiovascular centers, okay, they're the cardiovascular there are two centers, the cardiac area and then vasomotor area. The cardiac area, the cardio acceleratory area, which is which control the sympathetic neurons, and cardio inhibitory, which is control the parasympathetic neurons. Okay, and the vasomotor is control the vascular activity. Basically, the vascular means that it is supplying the arteries and not the veins. Okay. The autonomic nervous system, okay, changes the permeability of the sinoatrial node within the heart, okay, so it increases actually the permeability of the sinoatrial node of sodium and then calcium. If more and more sodium is going in and calcium is going in, more and more increasing the membrane potential, and then more and more increasing of the heart rate. Similarly, the parasympathetic is going to increase the permeability of the potassium. Potassium is supposedly the inhibitory um, ion, and that is causing the decreasing of the heart rate. Okay. Right here, as you can see right here, the normal heart rate is going to be look like this, which is the 75 beats per minute, more or less. The parasympathetic, which increasing the potassium permeability, it is decreasing the heart rate, which is showing the 40 beats per minute, which is the slower the depolarization, causing more of the hyperpolarization because of the more potassium availability. Okay. At the same time, sympathetic stimulation, which is the epinephrine, okay, or norepinephrine, that is causing the reduced of the threshold and causing the now what they call the reduced repolarization and causing the more depolarization, and also increasing the heart rate, which is the 120 beats per minute. But we got to understand, that the maximum heart rate of any individuals can be 220 minus their age, so that is going to be the maximum heart rate. Okay. So understanding about the baroreceptor reflex. Okay, so baroreceptor reflex, what does it do in both aortic arch and the carotid arch? Detect the rise, if there's a detect in the rise in the mean arterial pressure, so decrease in the sympathetic nervous system, which is ultimately causing decrease of the heart rate, and increase of the parasympathetic nervous system, which is causing decrease in the heart rate as well. So baroreceptor detective fall in the baroreceptor detective fall in the mean arterial pressure. As you see, the arterial pressure has a decrease in both our aortic arch and then the carotid sinus. So ultimately, this causing the increase of the sympathetic nervous system, which is epinephrine, norepinephrine, and also it causing the decreased parasympathetic, which is causing the decrease of the cardio inhibitory effect. Okay. Okay. The chemoreceptors, which is not going to be really our topic to discuss, but I can tell you briefly. The receptor they detect the low oxygen and high carbon dioxide, and also chemoreceptors also check the acid level as well. If it is acidosis, which means more carbon dioxide, it is going to tell the centers to increase the blood pressure, which means increasing of the heart rate. Okay, and cardioreceptor decrease if it is high in oxygen and lower carbon dioxide and low in acid, okay, which means the acidosis. Okay, tell the cardiovascular system to decrease the blood pressure, okay, and ultimately decreasing the heart rate as well. Okay. All right, so factors affecting the heart rate, like there's a Bainbridge reflex. Okay, the Bainbridge reflex is going to say, like they're telling the heart, okay, I'm getting more and more. For example, if it is positive reflex, it's going to be telling the heart, the autonomic nervous system to to decrease the heart rate. Okay, um, and if it is, the Bainbridge reflex, sorry, not the autonomic system. The Bainbridge reflex is connected to the venous return. So venous return is high, and then the atrial is going to stretch, and then ultimately the autonomic nervous system is telling them, okay, hey, I need more venous return, I need more cardiac output. Okay, so that is going to be ultimately causing the cycle, like going over and over again, and then more than likely is going to take the person towards the heart failure if venous return is more. Okay. All right. So right here, it is showing the the factors affecting the stroke volume. If the precisely if end diastolic volume is high, the stroke volume is going to be high, as I discussed it in the previous slide. And then if it is end diastolic volume is low, the stroke volume is going to be low. Okay. So that is going to be, so we need to focus on the end diastolic volume decrease. So decrease stroke volume, it is going to be decreasing the cardiac output and ultimately better for the heart. Okay. The chronotropic agent, okay, so chronotropic agent, okay, the effect on the heart, okay, so chronotropic is like the positive chronotropic agent, norepinephrine, epinephrine, thyroid hormone, okay, and then the negative chronotropic agent, which is going to be the digoxin. Digoxin, for your learning purpose, like this is going to be not very good drug. It is going to be used as a last resort, not used for the regular use, okay. And that causes the increasing of the heart rate and all that, but not used because it has more side effect and more side effect on the person and also the heart as well. The inotropic agent, okay, the positive inotropic agent, the hormones, which is norepinephrine, epinephrine, thyroid hormone, which is increasing the heart rate, increasing the cardiac output, and ultimately causing the person towards the heart failure. Beta 2 agonist, those dobutamine, dopamine, and isoproterenol, okay, not used regularly but can be used, okay, but that causing the increasing of the sending the signal from the now we call the SA node towards the heart and ultimately causing the increasing the heart rate, okay. If you increase the what they call the calcium, that is also going to what they call increasing the heart rate, which is called the digitalization precisely. Okay. The negative inotropic drug, which is the amazing drug, like that we have the beta blockers, Olol. If you see the Olol in many names, guys, there's supposedly going to be a beta blocker more than likely. So propranolol, metoprolol, atenolol, labetalol, carvedilol, okay, all the Olol, okay, isoprotrenol, okay, all the Olol is going to be the negative inotropic drug that is going to be decreasing the workload on the heart and causing the um, uh, become the life-saving drug and also getting the better for the heart. Calcium channel blocker, not very widely used, but is widely used as in the cardiac arrhythmia. Those nifedipine, verapamil, deltazim is also used, okay, as a negatively inotropic drug, okay. Now we're gonna do the carotid sinus massage. Okay, so we discussed about the carotid sinus, which is supplied by the glossopharyngeal nerve. So if we do the what is it called? A more carotid sinus, it is going to decrease the blood pressure in the end. So what does it do is the blood pressure decrease the carotid sinus massage to study the in this study the researchers studied that the blood pressure decreased after carotid sinus massage to study the cardiac inhibition, and then the atrial vasodepression, which is the decrease in the blood pressure. Okay, so whether the cardiac inhibition and then the atrial vasodepression occurs independently of one or the other, and how the BP decrease in the end. Okay, so researchers measure the blood pressure, heart rate, and then the stroke volume and total peripheral resistance. Okay, respectively to the cardiac sinus massage and the two Dutch syncope centers. Okay. So the longer the carotid sinus massage duration yielded a larger changes in the blood pressure medication through a strong atrial vasodepression. So vasodepression is happening and BP is decreased. So the blood pressure decrease evoke the corrective increase in the heart rate and then the what is it called? The total peripheral resistance. Okay. So cardiac inhibition, okay, appears as the phasic response, okay, to the onset of the massage and independent of the what they call the atrial vasodepression, okay. So the blood pressure correction, okay, probably depend on the collateral, okay. So in this study, they only did only one cardiac carotid massage, not the both, like um, you call carotid massage. So if it is both is doing like at the same time, but you gotta make sure that like do not do around this like the same time. Just do it like one and then two and then one and then two, not like together. Okay, not like one and two like simultaneously with one with two hands together. You have to do like one hand with right, one hand with left, one hand right, one hand left. Okay, so that is how it is going to be decreasing the blood pressure together. Okay, so blood pressure correction probably depend on the contralateral sinus, okay, and aortic beta receptors. So blood pressure decrease after the sinus massage may in part depend on the efficacy of the corrective response. Okay, so right here in this picture, the carotid massage. So it is only one carotid is being used. The other one is not in use. So what is ultimately having for this one that the blood pressure, the heart rate, blood pressure, and total resistance is decreased. Okay, and then for the other one is going to be increased. Okay, so as soon as like the carotid sinus massage is done at the same time, so heart rate, blood pressure, and total peripheral resistance is going to decrease. So if we do like the both sides together, more than likely it is going to decrease the what is it called, a like heart rate, blood pressure, and total peripheral resistance decreased both simultaneously. Thank you.